I'm Laura Mcfarlane and I'm the lead director. As a complex research driven programme, we are delighted to be able to present some of our findings to researchers, policymakers, decision makers, practitioners and commissioners, and to our wider supportive community. Over the lifetime of the programme, we have taken a broad approach to gathering insights and learnings. We have used a variety of methods, data analysis, using theory-led approaches, and carried out specific service evaluations, among a range of other learning activities. You will hear about many of these today. But first, I want to say a few words about the journey of LEAP and how we got here. This photo was taken on the press day when we announced to the world that Lambeth had been awarded 36 million from the National Lottery Community Fund. You can see the excitement and the anticipation as we felt as we embarked on this journey. The people in this photo represent a range of stakeholders, from parents to service providers, from public health colleagues, GPs, trustees and clinicians. LEAP was born from a strong commitment in Lambeth to improve outcomes for babies, children and families. Lambeth had a robust set of Sure Start local programmes, evolving into borough-wide delivery of 30 children's centres, one of the largest programmes in London. Early years provision in Lambeth had a strong political and strategic support. We were early in establishing integrated joint commissioning models that supported an increasingly joined up and holistic approach to delivery. The exhilaration of securing 10 years of funding to build on and develop our understanding of how to innovate, integrate and improve outcomes was hugely exciting. I'm now going to talk a bit about how we set the programme up and some of the principles we applied to this process. We developed an integrated theory of change working with Dartington Service Design Lab, our evaluation partner, to show how we wanted to contribute to improved outcomes for children and families by building the foundations necessary to strengthen the environment surrounding children. This integrated theory of change was developed from pre-existing theories for the programme and our portfolio of services. These key components show at a high level the approaches that we took in the early stages of the programme. During the bid preparation stage, we undertook a rigorous needs analysis, which informed the selection of the location of the programme and identified unmet need within the wider system. The lottery's guidance was to deliver the programme to roughly 20% of the Lambeth population. We took a wide and deep engagement approach to heighten awareness of the potential of the opportunity across the sector, making sure we created chances for all to have their say about the location of the programme and the kinds of services we should deliver. A wide range of partners coalesced around the development of the bid in the early setup phase, and this commitment continued once the programme was up and running. We created a shared mission to improve outcomes and utilise the capacity within the core team to provide a space to create a collaborative environment. Lambeth was ignited by the opportunity to make a difference for babies and children. An executive and board was established for cross-organisational collaboration and for unblocking challenging issues where needed. The test and learn opportunity enabled us to try out different approaches to understand which best suited our local population and maximise the contribution of our partners. There is no manual for programmatic working, especially over a 10-year period, and one that was as changeable with COVID and the cost of living crisis, which dramatically affected the local context. We were in fact building the boat while we were sailing in it. Once we started developing, the scope became clear in terms of the size of the team we needed, the skills and competencies that we needed to deliver the programme. This slide shows the range of services that we delivered as part of the LEAP programme. Services were designed to improve children's diet and nutrition, social and emotional development, and communication and language skills, as well as the maternity strand. Over the lifetime of the programme, we funded 31 local services to support families during pregnancy and early childhood. We integrated existing evidence-based services with newly developed ones, using the latest science and developed local innovations to address local needs. Our service offer fell into two broad categories: direct support for children and families to improve outcomes, and support for early years practitioners and the community to increase local skills and awareness. In line with the proportionate universalism approach, we supported families with different level of need and offered more intensive support to those with greatest need. We learned that the process of implementing evidence-based programs is not necessarily straightforward, and we worked collaboratively with our delivery partners to ensure the best fit for our community. During the programme's first 5 years, we focused on establishing and developing local services involving stakeholders and parents in service design and building and training the workforce necessary to deliver an integrated programme. From 2020 onwards, we prioritised resources for the most promising services, resulting in a more streamlined service offer. We created a service review framework which formed part of our commissioning process and also provided a space to review implementation plans, consider how delivery was going, unblock any organisational barriers, and latterly look at what the data was telling us. This helped us to ensure that high quality services were being delivered. So just a couple of snapshots of some of the services. So our oral health service was made up of different components: training for early years practitioners in early education settings to enable the delivery of a supervised toothbrushing programme, as well as the distribution of toothbrushing packs and an oral health promotion programme in the community. This was an evidence-based approach adapted to local contexts, including COVID adaptations. Social and emotional development. Enhanced casework. Our original needs analysis showed us that the prevalence of domestic abuse was high in the borough and remains so. Recognising the devastating impact of domestic abuse on children, we were committed to create a service that recognised the need for prevention and early intervention in this area of work. This was truly a collaborative endeavour, which went on to create the enhanced casework team. Communication and language development. Natural Thinkers, born of Lambeth. This programme supports teachers and early years practitioners to connect children with nature and to bring the whole curriculum outside. This supports well-being and communication and language development. In addition, with our midwifery partners, we created a caseload midwifery team offering continuity of care to pregnant women and their families. Many of these services have now been handed over to local partners and will continue to be available as part of the local offer to families. Thinking about connecting, clearly a set of services on its own is not enough. They need to be connected to each other and to the community. It was LEAP's role to connect the range of different professionals that needed to work with each other. This intentional activity was part of the LEAP core team's function. As the programme developed, more and more connections were being made between organisations, delivery partners and our voluntary and community partners. Our approach was flexible and iterative. Activities were developed and improved over time based on learning and feedback and tended to contribute to more than one of these 4 overlapping areas. Improving child and family spaces. We spent 4.3 million on redeveloping 11 children's early years sites to ensure that they provided high quality, accessible and welcoming environments for families and facilitated collaboration between services. We created new play spaces, improved local community hubs to enable access by families with young children, and significantly expanded 4 children's centres by providing health rooms, outdoor growing and play space, and increased space for multi-agency working. Convening and connecting the workforce. As the cohort of LEAP Commission's partners grew, we realised we had a perfect opportunity to facilitate a more meaningful connection between each service. We further increased the collaboration between professional groups and enabled a deeper understanding of each other's pressures and opened up spaces for joint working. The Providers Forum brought together all services providers on a quarterly basis, focused on updating programme developments, sharing new information, gathering feedback, and fostering networking to enhance service knowledge and collaboration. This convening approach provided a rich opportunity for services to develop productive working relationships. The Providers Forum soon became a valued part of the programme, providing an opportunity for services to share, collaborate, and create new offers for parents to participate. Community engagement. Our community engagement work is underpinned by 4 key approaches: delivering hyperlocal activities, building local partnerships, working with and being led by families, and developing and connecting and building trust. And you can hear more about that later in this webinar. Connecting activity is not just a nice to have. We learned that this type of activity creates innovation and has the potential to optimise financial and human resources. The value of convening the workforce provides opportunities to share, collaborate, and supports the development of relationships, trust, and learning networks. Creating opportunities to share and engage across organisational and professional boundaries, particularly in a complex environment, has proved invaluable as part of this programme. Workforce development. Our workforce development approach supported Lambeth's early years practitioners through tailored capacity building. We focused on individual competencies with training and webinars, institutional development with conference and training manuals, and focused on organisational growth through investing in new skills development. In terms of individual competencies, we were offered a broad range of topics, including healthy eating, infant feeding, domestic abuse, infant mental health, food and fuel poverty, and many more. These have been delivered in a variety of ways, including face-to-face training, webinars, and parent volunteer development. For example, the family partnership model created by the Centre for Child and Family Support at South London and Maudsley is an extensive training programme which provides a framework for practitioners to work with families in order to develop a shared understanding of their needs and priorities within a supportive casework context. The model is now being used across all of Lambeth children's centres. An example of developing institutional capacity. Our LEAP Health team developed a tool to support early identification and support of social risk factors during pregnancy. This tool has now been adopted by the Royal College of Midwives and will provide midwives across the UK with a standardised assessment tool to better support women in their care. We are very proud of this tool, which supports national ambitions for more personalised, client-centred midwifery care. We have embraced and tailored and flexible approaches to delivering training, bringing clinicians out of their clinical spaces and offering in-setting training at evenings and weekends. LEAP has advocated for the importance of early years in policy and practice throughout local systems. We also shared what we learned along the way to create a more conducive environment for early childhood development beyond LEAP's lifetime, both locally and nationally. LEAP has been a constant champion for early childhood, making sure that babies and very young children are always considered in any public health and education and health approaches. A significant opportunity to influence the system nationally was alongside our Better Start teams in Blackpool, Bradford, Nottingham and Southend. The Start for Life model demonstrates that close attention was paid to the configuration of Better Start programmes, and we can clearly see the fingerprints of the approaches we have taken. We are particularly pleased that as part of the recommissioning process of the Violence Against Women and Girls Service, Refuge will continue to offer specialist support for children, young people and their non-abusive parent, utilising learnings from the LEAP Enhanced Casework Support Service. In terms of generating insights, as the programme gathered momentum, we used the opportunity to gather and share insights relating to our work. Initially, our sites focused on the implementation of services and reflections on reach and performance. Later, our data integration and shared measurement system enabled us to begin to evidence impact. We created a number of reports to demonstrate this. I'm going to reference a couple of these. Our first annual learning report gave us insight into how parental knowledge, skills and behaviour have changed because of involvement with LEAP. Insight into how parents and carers experience LEAP services. 79% of parents would highly recommend LEAP services to family or friends. Our second annual relearning report enabled a deeper understanding of patterns of engagement, service pathways, and the contribution of community engagement makes to initial and sustained engagement of families. This has shown us that over the lifetime of the programme, LEAP has reached a total of 15,374 families, and we have engaged an estimated 2/3 of children under 5-year-old living in the LEAP area. The community engagement team have developed a data-driven report, Community Engagement in a Diverse Inner City Area, which explores the approaches taken to successfully engage with families, offering deep insights into methodologies we use to connect with our local communities, as well as how working in partnership with local organisations support this process. A report published in the British Medical Journal showed that the LEAP model of caseload midwifery care improved outcomes by significantly reducing preterm birth and birth by caesarean section when compared with traditional care. This data trend suggested that when applied to target groups, women in higher IMD quintile and women of diverse ethnicity, that the impact of the intervention is greater. We utilised the systems and networks that we had created or were part of to share our learning widely. We delivered webinars, spoke at conferences and tapped into London-wide and national networks. We hosted many visits from partners from far and wide, and it was wonderful to have the opportunity to share our learning and learn from others as well. The LEAP Partnership Board brought together a wide range of delivery partners, decision makers, third sector partners and parents to steer the programme and develop a network around the delivery of programmes and services. An example of the wider system coalescing around a particular need was the early formation of the parent-infant team. Partners from across the system, driven by the chance to address an unmet need, came together very early on in the programme, and the PAIRS team was the first LEAP service to be created.
Hello everyone, I'm Melissa Kelsey, the Clinical Service Lead for PAIRS. I'm going to give you a brief presentation on the evolution of the Lambeth CAMS Parent and Infant Relationship Service, known as PAIRS. The PAIRS service was one of the first specialised parent-infant teams in the country, created in 2015 with LEAP funding. Initially, the focus was on setting up early intervention and preventative work from conception to the age of 4. Families living within the 4 LEAP wards could access direct specialist psychotherapy support via professional self-referral. In 2016, the service began the development and delivery of a therapeutic parent-baby group called Together Time. The service also identified the need to provide support and advice to the local early years workforce through consultation, reflective supervision and training. It has continued to adapt and grow into a multidisciplinary team within CAMS, now working with pre-birth up to the age of 5 across the borough of Lambeth. With the help of the next slide, I will talk you through the current service offer in more detail and how this has contributed towards the system's change. The PAIRS triangle model provides an overview of a tiered system of interconnected, preventative intervention with the potential for families to move between universal, targeted and one-to-one support. The PAIRS service is right in the middle of this triangle, working at multiple levels, holding the different parts of the system together to focus on the baby and the parent-infant relationship. We have the one-to-one therapeutic intervention at the top of the triangle. This includes targeted work with families, often in socially disadvantaged groups. They are usually experiencing complex and/or enduring difficulties in their early relationships, where baby's emotional well-being and development is particularly at risk. Parental feedback obtained about the one-to-one service during pregnancy told us that having someone to speak to and help them through emotions and feelings was very important and helpful, and it helped to continue on with their pregnancy in a better mood and with a better mindset. Alongside the one-to-one work, the service has been able to network with and support professionals who wish to access further thinking around infant mental health and relationships. There is a borough-wide consultation offer available to all professionals, including social care, early intervention health visiting, perinatal and adult mental health, to name just a few. We have also developed a strong collaboration with caseload midwives, previously funded by the LEAP team, supporting referrals for one-to-one parent-infant psychotherapy in pregnancy. As mentioned previously, the Together Time group offer, right in the middle of the triangle, has been successfully delivered in Lambeth Children's Centres since its conception. The group is for families with babies aged 3 to 8 months, and it enables parents to access psychodynamic support in the community without a formal mental health referral. Initially, it was a small-scale PAIRS offer, but through regular data collection, including parental feedback and service development, the service was able to build relationships in the community and gain interest both locally and nationally. Parents have told us that the group has provided a sense of community for them, offering support and learning about child development. One parent stated it was interesting to share the space with parents from different backgrounds and life experiences and to hear different views, stories and ways of relating. PAIRS was also instrumental in setting up the Circle of Security parenting groups, a manualised attachment-based parenting programme delivered across 8 sessions to parents. This also evolved from a small-scale PAIRS service offer in 2018 to working in partnership with the Lambeth parenting team and Children's Centre Better Start workers. Along with Together Time, it is now part of the Lambeth parenting support offer available across Lambeth, delivered in partnership with the local authority as part of the Start for Life offer. Furthermore, we have a strong consultation and reflective space offer for professionals who are providing targeted and universal support in the borough. PAIRS offers regular reflective space for co-facilitators delivering Together Time and Circle of Security groups. We also offer reflective space for Baby Steps, a 9-session parent education service delivered by mixed teams of midwives and health visitors antenatally and postnatally, designed to prepare for the transition to parenthood. This has helped to foster stronger partnership working between children's centres and other local voluntary services. We have developed a package of training centred on the parent-infant relationship and child development with an emphasis on supporting the workforce to think baby. The service has offered training locally and nationally, actively engaging with other parent-infant teams to support and share good practice. To the next slide. This graph here shows the growth of the service engagement since 2015 to the last financial year. What you can see here is the number of appointments has increased year on year, apart from the COVID period. from the 100 mark in 2015 to nearly 800 appointments with families in 23-24. So there has been a steady increase in referrals, interventions, and families accessing support. This also demonstrates the length of time it takes to embed a new service. I am now going to provide further detail on the recent evaluation of the service undertaken by the Centre for Maternal and Child Health Research led by City University. This evaluation has shown that PAIRS is greater than the sum of its parts, so the success of the service depends on the interconnectedness of its parent-infant psychotherapy, group work and workforce development offers. These words and this model does not really do credit to the impact that LEAP has actually made. Described as a rare jewel in the report from 2019 and also a winner of an award from the Association of Infant Mental Health Foundation just this year, PAIRS has impacted Lambeth substantially in recent years, taking their understanding of the centrality of the baby brain and the importance of prioritising good enough bonding from conception onwards. This is the incredible work undertaken by my colleagues in PAIRS for nearly 10 years. LEAP have provided the ecosystem for this to develop, and PAIRS is now able to be part of and influence young lives and families in varied parts of the community. At the risk of repetition, the current structure has PAIRS working in all areas of the community in the service of the relationship. This is what sets it apart from other services that might focus on maternal mental health in isolation. It is in addressing the baby blind spot that developing relationships have awoken and led to the increase in referrals. One of the drawbacks of the pyramid representation model is that it does not do justice to the way that different aspects intersect and encourage dialogue, learning, and relationship building at every level. One of the main findings, as highlighted by City University, is around interconnectedness. PAIRS cannot be successful in supporting families in Lambeth without building capacity in the local early years ecosystem. The local capacity building that PAIRS has been involved with leads to more awareness of infant mental health and the service itself. This, of course, means that more parents and carers are being supported who report benefits such as improved parent-infant bonding, improved confidence in their parenting skills, and improved mental health. Practitioners who had been recipients of PAIRS interventions reported awareness of infant mental health within the local early years service has been improved and enabled by PAIRS through training, reflective supervision and consultation. Reflective supervision for the early years workforce and consultation about potential referrals were highly valued as these sessions build expertise and offer support for practitioners and was an enabler for appropriate referrals. To finish, I would like to quote a participant in the study who stated, "I think PAIRS, has been really effective in increasing the kind of understanding of infant mental health and of the parent-infant relationship, and the kind of everything about the importance of attachment and the kind of long-term outcomes for that there's a kind of awareness raising through that public health messaging." Thank you for listening.